Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Rudro. I know the series is little bit long in the as number of lectures are considered, but it was necessary from my point of view because each and every clinical manifestation of heart disease we have discussed so far, we come across in our practice very regularly. So I have to give that time for all these different symptoms or disease of heart to discuss with you. Today also we are discussing some clinical conditions of heart, but main focus of today's lecture is my opinion regarding cardiac treatment as far as experiences of patients are seen, which is equally important by my point of view. So let us first discuss few conditions which are seen in the regular practice. One is about the valves. The common is mitral valve stenosis. Now in the stenosis, the valves get locked up and there is no free movement of valve. You know everything. At Dravya level, I have not seen so much of patients about that, but it is very difficult to treat at a physician level by merely Kalpa or Dravya because it's a structural deformity. So for that calcification, there is a calcification and there is stenosis. Then some Vaidya use Asthipachak, but I have hardly seen the patients also of stenosis, so I will not comment. But just there is a trend to use Asthipachak Dravya or Asthipachak Kalpana, so to reduce the calcification. The another common thing which is seen about the valves is the prolapse of the valves. So because of the prolapse, there is no proper locking of the valves and there is regurgitation of the blood flow in the opposite direction or upper direction. Here also you can use as a Karvaskar because these are involuntary valves or muscles, involuntary muscles, and to get that tone you can use Karvaskar or even some way Arjun also to have their tone by astringent property. But again, it is a time consuming treatment, and if the symptoms are really worsening or severe, then you have to think of that how much long you are going to take time for the treatment. Another one is triple vessel disease is also a serious condition, and all these valvular disease may require surgery as there are structural defects. So these are the few points I wanted to add in this series of Rudro which we come across the regular clinical practice. Now regarding cardiac condition or cardiac disease and Ayurveda, we have different medicines or kalpa like Hemagarbha, Rasa Sindur, Yogendra Ras, Suvarna Kalpa, no doubt about that, and they are very effective also. The question is when you are going to treat any patient of the we have discussed the conditions we have discussed. We have good medicines, good kalpa, you have good diagnosis. Still, I will say, it's my opinion again, that think of the severity of the disease when you start the treatment. If there is acute infarct, severe anginal pain, severe breathlessness, you can treat in this condition with all this kalpa, provided you have a strong confidence that your kalpa is going to control that acute condition, that emergency. If it is really not in your capacity, please refer to the institute where it requires ICU or any other medication. But I have seen the patient, not in my practice, but experience of people that Ayurveda can cure anything in any emergency, and we have good this kalpa, and they have wasted time and patient really went in a dangerous situation. Now, so that's why if you have really confidence to do that, you can definitely do. But if you don't have such time in hand, please don't have ego of any science or personal ego and refer the patient. I am telling you again and again because I have seen the patient which were manageable by the emergency medicine, but they took time either by patient or by Ayurvedic Vaidya that will get cure, it will get cure by Ayurveda, and it was then out of control. I am not blaming Ayurveda or any Vaidya, but the demand of situation demand is very important when you start a treatment. Sometimes patient has got time, okay, there is no need of emergency bypass or anything, but angiography or other ingression show that the patient will require bypass or some surgical treatment by in the future time period. I have seen the patient, okay, we have time for the bypass, but there is we can treat by Ayurveda. Patient has taken treatment 2 years, 3 years with symptoms ongoing, breathlessness, palpitation, high blood pressure, edema, whatever it is. But Ayurveda can cure everything. Patient taking treatment continuously for years, and then symptoms became so severe that they had to go for the bypass. I am not uh, disrespecting any Vaidya or our science, but at least if you are treating such patient that you have time and you can definitely try to save the bypass surgery, then at least make a framework of time that how much months, days I am going to treat the patient, and after that period I will evaluate again, and then I will decide whether I will continue my medicine or I will refer to the other doctors or institute, that because I have already taken much more time for the treatment. This is just on the background of humanity and nothing else. I have seen the patient taking very generously heavy treatment with faith in doctors, in the science, but after some period, patient is at the same stage with same anomaly, and there is no improvement in cardiac symptoms either, or structural or report wise also. So just it's my request to you, treat the patient. Definitely you have confidence or you have time, but fix the time line that I will treat this patient up to this months, and I will evaluate clinically, investigation wise, and then only I will take decision whether I will continue the patient or treatment further, or I will refer for the surgical or any other procedure. See, our aim is to save the life and not to have egoistic for either for science or even for ourselves. You will find this episode little negative, but practically I have seen many, not my practice because I don't take so much chances, but in experience of people around me, that they after they said that we should have gone to we should have operated, then we would have some different picture in our family, like that. So this is about the cardiac series. I will like your suggestions and your opinions about this series. We will come with the next topic in the next week. Thank you very much.